Hello. Most times we experience pains around the hip, pains that are sometimes very severe and other times just mild. As lay people, we attribute the pains to so many things, including lifting weighty things, sleeping in abnormal positions, etc. Well, time now to have a proper discussion on possible causes of those pains. Hip fracture is a topic of discussion today on Seeking Solutions NTA Enugu Network Center. Thanks for joining us. I am Minna Adobe Okobasi. Our guest today is a senior registrar in orthopedics and trauma. That's to assure you that he's well grounded to dissect the topic at hand. Dr. Abo Emmanuel, thanks for coming to the Solution Ground, Doctor.
Thank you.
All right, the topic and what it says, hip fracture. What exactly is hip fracture?
Hip fractures are fractures that occur in the upper quarter of the thigh bone, which is the femur. The femur is the bone that articulates with the pelvis in the ball and the socket joint of the hip. It is designed to allow for free movement. However, there are a lot of structures that tend to hold it restrained. Some of them are the cartilage, the capsule, and the ligaments. The hip has the strongest ligament in the body, and these structures are called the static stabilizers, because they hold the hip and they prevent it from either dislocating or to resist any other external force. There are muscles that pass from the trunk and also from the hip bone down to the femur that help in moving the hip joint, and also to protect and direct these motions of the hip joint. These muscles are called the dynamic stabilizers. So with this, the hip has a very strong protection. However, depending on the strength of the bone and the amount of force that is impacted on the hip, the head or the neck or the junction between the neck and the shaft of the femur may fracture, resulting in a fracture, which is classified as a hip fractures. This fracture can occur either at the head, at the neck, or at the junction between the neck and the shaft, which we call the petrochanteric regions or petrochanteric fracture. Now, a fracture of the head of this femur does not usually occur in isolation in adults, okay, except in children whose growth plates have not fused. It is rare and uncommon for fracture of the head of a femur to occur. It usually occurs in association with a dislocation of the hip, and so it is classified or grouped and discussed together with a dislocation of the hip. So for our purpose of discussion today, we are looking at fracture at the neck of the femur and fracture at the junction between the neck and the shaft of the femur.
Okay, so what are the possible causes of this fracture?
Yes, except for when a tumor has eaten up the bone and the bone just gives way and breaks. Most times the cause is usually from an impact. However, the severity of an impact that will produce the fracture depends on the quality of the bone.
Okay. Now,
in a healthy young adult with good bone quality, it requires a strong impact, such as a motor vehicular accident, fall from height, direct blow, like in a fight or in a contact sports. Otherwise, such a strong force is required to fracture cause a fracture of the upper parts of the femur. That's the hip fractures. However, in people who have lost their bone stock, in elderly people whose bone stocks are poor, or in people for whatever reasons, maybe people have been on some drugs like steroids, and people whose bones have been weakened by other conditions, maybe from other metabolic causes of bone diseases, and maybe some tumors, people who take alcohol, and people who take tobacco in large quantities. These people have a poor bone stock, and any trivial impact can result in such a fracture.
Okay, so sometimes most people just wake up in the morning, like we said, and wake up with pains on the waist and all of that. What should one be looking out for as the signs and symptoms of hip fracture?
Hip fracture is a serious condition, and as such, it produces a very severe pain. Usually, the pain is sudden in onset. As soon as the bone breaks, the pain starts.
Okay.
The pain can usually be localized in the hip, around the hip. It can also be at the buttock, at the low back, at the upper thigh, even in the groin. However, the pain is usually very severe, except in the case of stress fracture, when the fracture is from repetitive motion and high force impacting on a bone. So that was what we call a stress fractures. Then in that case, the pain usually starts mild and worsens with time.
So are you saying that there has to be an impact on the bones for a fracture to occur? A forceful impact on the bone?
Unless a tumor or the cancerous cells just eat up the bone and the bone breaks up, there will usually be an impact. However, in a very severe form of osteoporosis, that's a condition where the bone quality is markedly lost. Some trivial forces can bring about these fractures. For instance, maybe dancing, even twisting can result in this fracture depending on the quality of the bone.
Okay. Which people usually suffer most of this hip fracture?
There are risk factors for hip fractures. The hip fractures usually occur in elderly people because of a loss of bone stock. As one grows older, the bone stock diminishes. So it gets to the point that the bone becomes very weak, and any trivial injury will result in a fracture.
Okay.
So people with this osteoporosis are at a higher risk. Then as people grow older too, men and women, the male hormone testosterone and the female hormone estrogen help to preserve bone stock. As one grows older, the concentration, the quality, the quantity of this hormone diminishes in the system. So it gradually, the bones will gradually begin to lose their stock. In women, when they get to menopause, estrogen completely usually drops drastically, and this change becomes very rapid. And so women suffer much more, are much more disposed to having these hip fractures than men. I mean older women, postmenopausal women who have attained postmenopausal age.
Okay. Is it possible that some other health conditions can result to hip fracture?
Yes. There are, because when these bones have lost their the quality of the bone, the bone stock has markedly diminished. Any trivial injury can bring about these fractures. So there are so many the elderly people that are talking about are predisposed to these injuries, and the elderly people fall much more often than strong, able-bodied men. This is because as the person also grows old, the muscle weakens. And when the muscle weakens, the person loses balance. Of course, the muscles are important in maintaining balance. So the person loses balance, and there is more at a risk of falling down. Again, elderly people have some conditions. Like most of them, some of them that have stroke. Stroke now will also cause more further muscle imbalance, and the strength of muscle will drop, thereby predisposing the person to falls again. Many elderly people have problems with their visions. Because of that, they don't see very well, and they keep on bumping into objects and they're falling. And because the bone stock is very poor, when they fall, they usually sustain this fracture. Some elderly people are on several medications for one health condition or the other. These medications, some of them cause dizziness. So they are dizzy, they trip, and they fall. In our homes today, many homes have tiles. And these elderly patients, because of their poor balance due to the strength of the muscle that has diminished, the person will just easily slip and fall down, thereby sustaining fractures of the hip.
Okay. All right, so we have concluded here that these fractures are usually experienced by elderly people, and of course women who are in their post-menopausal stages, and of course men too who are old, and those who are into some form of medication that affects their muscles and limbs and all of that, right? All right, we're still here on NTA Enugu Network Center discussing hip fracture. Of course, Dr. Emmanuel is still in the house. We'll take a short break now. The program returns after now. Stay with us. Welcome back to Seeking Solutions. Hip fracture is a topic of discussion, and of course I'm sure one or two of us listening right now will have a whole lot to learn, and Dr. Emmanuel Labo is still in the house. All right, doctor, let's look at the situations of victims of hip fracture. Can they still walk? A patient of hip fracture, can the person still walk?
Yes, the aim of treatment is to get the person to his near morbid condition. In other words, since most of these patients are elderly patients, the aim is to get them up and about as early as possible so they can walk.
Okay. Is it possible that without medication, hip fracture can heal?
Usually, hip fractures will not heal without intervention. However, there are few exceptions. That's in the young people, when the fracture is undisplaced, then you can just you can manage the person conservatively without any surgical intervention. Even at that, there is still high incidence of the fractures further displacing. So almost always hip fractures should be treated surgically.
Okay, physical therapy, what role has it got to play in hip fracture?
Yes, physical therapy plays important roles. Even before the fracture, during the treatment of the fracture, and after treatment in the rehabilitative stage. Physical therapy, including exercise, loading exercise, is very important because it helps to build bone mass, and helps to get the bone to the peak bone mass. So exercises load the bones, and the bones will become strong, so that even subsequently, if the bones will degenerate, it will not degenerate as fast. The bone of somebody who has trained exercises will not degenerate as fast as the person who lives a sedentary life. And now, when the patient has sustained a fracture, yes, if usually, because the person will be immobilized, the joint structures, the other structures around the joint will begin to contract with time, and so you need the physical therapy to keep this joint supple and mobile while treatment is going on, so that by the time you be discharging the patient will not come back with stiffness. Then after discharge, the patient continues on exercise, on physical therapy. Okay. You have to strengthen the muscles. You have to, of course, keep the muscles in their best length that will enable them function properly. Also, because the person is lying down, it's not just the hip that is affected that you need to exercise. The rest of the body, you need to exercise. Even the other limb, the whole body of the patient should be exercised. Because as one is lying down, the person is again losing a bone stock and losing even the strength of the muscles will begin to go down. So you need to exercise all parts of the body. And then for elderly patients who are lying down, the respiratory capacity already in the elderly patient, they have a low respiratory reserve, and when they lie down more, the compromise worsens. So while they are on bed, they need to do some chest exercises that will enable them to optimize their respiratory capacity even while on their sick bed.
Okay, doctor, I think it's time that we actually look at a holistic treatment available for hip fracture.
As a hip fracture, the treatment of a hip fracture, one is that you have to make your diagnosis, identify that this person has a hip fracture, and then know the parts of the part of the femur that is affected, because a treatment will depend on the particular on the parts where the fracture occurs. Now I have to look. Usually, a patient who have sustained hip fractures will have a pains in their hips. The pains are usually very severe because fracture pains are usually very severe. So they have severe pains. They will have a swelling. The pains may be localized to the hip, to the groin, to the back, to the upper thigh, but the hallmark is that it is usually severe, except in the case of a stress fractures. Now, if you look at the patient, there may be bruises around the hip, and also swelling in the proximal thigh and around the hip. The limb will tend to be externally rotated, and in most cases will be shortened. Now, so there are investigations that will help us to confirm that yes, this patient has a fracture, and then the particular point where the fracture occurred. X-ray is one of them. X-ray will show the fracture, and you will see whether this fracture is at the neck or is at the trochanteric region. They have the treatment considerations are different. If a fracture occurs at the neck, there is a high tendency of the head of that femur to necrose off. That's to because the blood supply will be cut off, and the head will die off. What we call aseptic necrosis or avascular necrosis. But in the case of the trochanteric fractures occurring around the trochanter, the blood vessels is usually and largely preserved. So in that case, most times the head is preserved. So the target will be to fix the fracture, to reduce the fracture, and then fix it, hoping that the head will survive, because usually the head will survive. However, in the case of a fracture to the neck of the femur, in young adults, young healthy adults who present early, you may still attempt to fix the fracture if you can achieve a good reduction, especially in the non-displaced fractures. However, in elderly patients, usually the target is to operate on the patient. That's for patients who have a neck of a femur fracture, and the operation will depend on other findings, including the state the hip was on before the injury. In some cases, ordinary partial hip replacement may suffice. In other cases, you may go ahead to replace the entire hip, both the socket component and the ball component. The target being to get the person up and about as early as possible.
Okay, is it achievable here in Nigeria?
Of course, it's achievable and it's easily achievable. It must be
very expensive then.
Partial hip replacement is not expensive. However, the total replacement at the moment is a bit expensive, okay, but it's still largely affordable.
Okay, let's look at the prevention of hip fractures.
Hip fractures are actually better prevented than allowed to occur. Prevention here will actually entail one, ensuring that the bone quality remains good even till old age, and then two, taking all possible measures to prevent falls in the elderly patients. Now, in order for us to ensure that the bone quality remains healthy, exercise is very important at any point in time, because exercise increases and maintains the quality of the bone. The amount of exercise one does as in his younger age is what keeps the person's bone at a later life. So at any exercise before the age of 25, reaching the peak bone mass is very important, because at that point you have once you have built that bone, it is now difficult that you build it and maintain it. It will be difficult. The bone will take much slower period before it will begin to go into osteoporosis.
Okay.
But then even if one has missed the opportunity of exercising in the maybe younger age, even at any time, exercise is still very important, because it still keeps the bone and stops it from further thinning out.
Okay.
Sometimes because of other conditions, maybe that people may have, like elderly who may have arthritis, it becomes difficult for them to load the joint by jogging or running. In that case, simple walking is a good measure. Just walk around, take a time, 30 minutes in a day, and walk around. It's still it does a whole lot in preserving bone stock, even in old age.
Okay, so if you don't have the time to go to sport facilities to exercise, you can just do a 5-10 minutes walk around the house, and it will be fine.
Yeah, just walk around.
And walk around. Okay.
Load the bones.
Okay. Well, Doc, I want to thank you so much for your time on Seeking Solutions today. We appreciate your time and efforts on the show today. Thank you so much.
Thank you.
All right, now you know the possible causes of hip fracture, the signs and symptoms. Does it sound familiar to your case? Well, you now know what to do. And that's where we wrap it up today on Seeking Solutions, NTA Network Center, Enugu. Let's do this again, same time next week. Until then, remember to exercise, keep those bones alive. Bye for now.